Thank you, and thank you for the support of the House to allow me to continue. I appreciate that. The text of the motion has been circulated to everyone, but to put it on the record, I'm asking under Standing Order 30 of our standing orders here that the ordinary business of the House be adjourned to discuss a matter of urgent public importance, namely the imminent risk to the health and safety of Albertans due to the state of emergency medical services in the province. Mr. Speaker, a similar Standing Order 30 request was brought to suspend the regular business of this House some 3 weeks ago, and since then we've been unable to find many improvements. Mostly there's been only further decay in the system. Indeed, doctors say that I've consulted say there are periodic improvements, but those are relatively transient and complicated often by other factors like training and availability of home care. I'm conscious of the citations available under Beauchesne and the House of Commons that I am arguing the urgency of the matter, but the issue of a crisis in emergency care across Alberta is compounding itself with the urgency of the situation continuing and exacerbating. For example, Mr. Speaker, we have had a hanging in an emergency room, and this absolutely should not happen. Aside from what has happened to the individual and their family, this person was in a care facility, and there was not capacity to adequately supervise that individual. And so we have someone who is in obvious distress and in a moment of vulnerability was able to hang themselves in an emergency department. And never mind, aside from what happened to that individual, just imagine being the staff person who eventually found them. We've had another miscarriage in a waiting room in Calgary. Now, that was brought to the attention of the government in the July 2008 memo from the ER doctors, and there has been no improvement and no change there. We've had a child dying in emergency with a ruptured appendix shortly after their arrival, and that reflects a failure to respond with full capacity. They did not have the adequate resources. So none of the 322 cases detailed by the ER docs recently are condemning in and of themselves, but the totality is the system is not working. So other problems persist, like the number of doctors available, a lack of genuine long-term care beds to discharge people to, and lack of fulfillment of a mental health strategy. So I looked under the House of Commons 689 to 698 around urgent and important and requiring urgent consideration. And there was some consideration possible under the previously published government's projected business. Under the House Leader's business published today and circulated to everyone in the opposition and to members of the government caucus, that bill is not up for debate today. So under House of Commons on page 693, we are talking that it is the matter is related to a genuine emergency, and the importance and specificity of the issue is important. And while we talk often about problems throughout the care system, we are dealing specifically here with the failure of resources, trained staff available, and ways of addressing the waitlist times in the ERs. So that is immediately relevant and of attention and concern through the nation, which fulfills that part of the House of Commons requirements. When I go to Beauchesne 387 and 389, indicating the primary concern and specifically whether there's opportunity for debate elsewhere, I have a long list that I usually run through for the Speaker, but I will note here that it's not before the courts. It wasn't. The ER issue was not specifically mentioned in the throne speech. There's no press release that I've seen, nor is there a budget that is going to deal with this imminently, or no notification of a supplementary supply budget. Under opportunities for debate, the Speaker himself often asks us to understand that oral question period is not a place for debate. And under government bill on the order paper, we do have Bill 17. As I said, it's not on the House Leaders' agreement of business today, and that bill specifically leaves all program details to regulations, so we have no idea of how the government would respond specifically to this. I also looked under both Shane 659 around second readings, which specifically says that this is and the second reading we've had earlier this week, but it is about the whole principle. It is not regular to discuss in detail the clauses of the bill. When I look at the section of 689 on Committee of the Whole, it indicates that there can be motions brought forward, but that is not on the order paper until next week, and we are not willing to let the intervening 5 days pass without the opportunity for more detailed debate on this specific issue. Based on the numbers that we are seeing for the last period of time, we essentially have a flat line in what's happening in our emergency. Even though the government has had this detailed since 2008, these lines are flat, so not enough is happening there. The Royal Alex is the highest volume ER in the province. The 8-hour response time over the last week has decreased, Mr. Speaker, according to the weekly Emergency Department length of stay summary.
The wait time has increased, didn't it?
The wait times have increased. I'm sorry, there's a percentage change there, and it's not to the good side. We've also had we're coming into the cold and flu season where ERs are even more pressed, dealing with the frail, the elderly, the homeless, and other disadvantaged, particularly the downtown emergencies. So the urgency of this issue continues for the House and for Albertans. It's so urgent, Mr. Speaker, that a government parliamentary secretary has broken ranks to directly criticize the Premier, the Minister, and the government, and I can think of no better way to illustrate the seriousness of this issue. If I may quote directly from that member's memo, he says, "Please do not feel comforted that healthcare will be any better with Alberta Health Services' inadequate plan to deal with the crisis," that's the ER crisis, "and disasters that we will be facing in the 4 winter months ahead." As I said, referring to an influx of cold and flu season, I ask the Speaker to please rule in favour of this motion and put the question to a vote of the Assembly. Thank you for hearing me today.